Welcome to video 3, where we're going to run through the signs of being in established labour, when to go to hospital, the admission procedure and positions for labour. So signs of labour, signs of being in established labour. Okay, so I spoke earlier about irregular contractions, but once you reach the point where your contractions are coming in a 1-5-1 pattern, usually that's a sign that it's time to go to hospital. Okay, so when I say 1-5-1, we're saying one contraction coming every 5 minutes, lasting a minute, consistently for an hour. When you're timing these contractions, you're timing from the start of one contraction to the start of the next contraction is the distance between them, and then obviously the duration of the contraction itself is how long the contraction is lasting. So, for example, if you had a contraction starting at 10 a.m., it lasted until 10:01, you had 4 minutes of a gap, and next contraction started at 10:05. That's a contraction every 5 minutes, lasting a minute. Okay, so we're just looking for an hour of consistent 1-5-1. The reason we like an hour of consistent 1-5-1 is because anywhere before that could have just been a coincidence. So you might have a flurry of contractions every 5 minutes for 25 minutes, and then they might just go away. And what we want to do is just help, I suppose, guide you to the point that you don't have any worries or concerns about things like that. You know that when you're having regular contractions in a 1-5-1 pattern consistently for an hour, you're coming into hospital, and it's more than likely the right time for you to be coming in. So what do they feel like? They will not stop or slow down regardless of your activity. So before, in early labour, I described how they were a bit stop-starty. Now you're in established labour, and whether you are on the birthing ball, standing up, in the bath, walking, they're still coming in that predictable 1-5-1 pattern. Over the course of the day, they're going to actually get increasingly closer together. So they may start off 1-5-1, and then they'll reach a point where they're 1-4-1, and then they'll reach a point where they're 1-3-1. Okay, they'll never really get closer together than 1-3-1. They'll last longer than early contractions. So I described earlier how sometimes they could be quite short. Established labour contractions are always minimum of 60 seconds long. They're stronger than early contractions, so they still have that same wave-like, build up, reach a peak, and then relax, but more than likely a little bit more intense. These contractions, you are breathing through them, and it would be very unlikely that you'd be able to chat through them, okay? And what's happening physically, how you might be feeling, and what you could be doing. Okay, so in established labour, what's happening physically is that thinning is complete, okay? If you remember from the previous video, irregular contractions are thinning the cervix, regular contractions are opening the cervix. So thinning has happened because these contractions are now regular, and opening is beginning, okay? So typically your cervix is probably in and around the 3 centimetre mark, and then as the hours go on a first-time baby, we would expect that cervix to open at 1 centimetre an hour until the point where you're 10 centimetres dilated. So that's as open as you're going to be. Contractions are probably lasting about 60 seconds long, somewhere between 3 and 5 minutes apart, like I just described. How you might be feeling? Okay, well, certainly you're feeling that these contractions are stronger, but you also might start to feel some discomfort radiating down to the tops of the legs, or sometimes radiating around the hips to the lower back. Your talkative excitement over the course of the day has probably now changed to seriousness and concentration. So generally you're quite focused and you're breathing deeply through these contractions. Your face is flushed. You can at times be preoccupied and restless, and generally you want companionship. So women in this stage of labour, in the established stage, they really want and need someone that they know and love and trust right beside them. So it might be their partner, their sister, their mom, but it's someone who you know, love and trust, who's going to make you feel safe and secure. Okay, so you crave that companionship. And what you can be doing, so this is probably the time that you're thinking about coming into hospital. So for your partner, they're probably double checking that there's enough fuel in the car, if they didn't do that a few hours ago. They are, putting the bag in the car, you know, you're thinking about making your way in. If you're comfy in the bath, you know, you might actually be quite happy at home, and you mightn't live too far away from the hospital, and it might be rush hour traffic outside, you know, so use your own common sense with it as well. If it's 5:30 and the way you travel to the hospital is exactly the same way as everyone else travels home from work, and you're feeling, you know, generally well, you're breathing through these contractions and you're very in control, feel free even to call the hospital, let them know what's going on, and maybe that might give you the reassurance to stay in the bath for another hour or two until traffic's settled, and then make your way in. Because always remember, like the 151, it's just a guide. We know that a first-time mom, her cervix is going to be opening at roughly 1 centimetre an hour. So there's always time to play around with her. Don't panic and stress out and worry. Okay. But what you can be doing, you're possibly thinking about coming in. In here, if you wanted us to run a bath for you, that's absolutely no problem. So just ask your midwife on Delivery Suite and we can organise that. You can walk around, so you might want to keep moving. You know, moving might have been working well for you, and we know that it encourages baby into a better position, as we saw in the previous video, so that might be what you're doing. Listen to your body in terms of positions, you know, so you'll find that some positions are sometimes comfier for you than other positions. In my experience, that is usually your body guiding you a little bit. So go with whatever your body is guiding you to do in terms of positions. You might be using a TENS, and you're most certainly breathing deeply now during your contractions. This is a long stage 1, okay? The easiest way, I suppose, to focus through it is just to concentrate on one contraction at a time. When that contraction's over, let it go. Enjoy the little break before the next contraction starts, and know that this is bringing you one step closer to your baby. Every contraction is your womb shrinking a teeny bit. That's what happens when you have a contraction. It just shrinks a little bit. Next contraction, a little bit more. So every contraction, whether it's irregular, regular, they all have a really important part to play in the birth of your baby. So just like focus on each one. When it's finished, enjoy the little break and get ready for the next one. Remember to urinate frequently. So why might that be important? So let's pretend this balloon is a full bladder, okay? So a full bladder can at times be about 400 mils full, so it can hold 400 mils of urine, which is a little bit bigger than a can of 7-Up, okay? And when you're pregnant, and especially when you're heavily pregnant, your bladder just likes to sit like just there on top of your pelvis, okay? So can you see how sometimes bladders, full bladders, can be a little bit cumbersome when it comes to established labour? Because we could have a baby who's in here, we could have a baby who's in here in the perfect position for birth, but maybe as that bladder started filling, it might have encouraged baby to move or twist, and he kind of got forced into a different position. Then you pee, but now we've got a baby who is no longer in an optimal position. So I would say from the time that your contractions are feeling wave-like, you know, from early labour, once you're not asleep, I would never wake from being asleep to pee, but if you're awake and you're just pottering around anyway, be mindful just to empty your bladder every hour. And what that's doing is just keeping your bladder empty and out of the way, so that baby is entering that birth canal entering that pelvis in a nice optimal position for labour and birth. Sounds a bit counterproductive, but drink plenty of fluids. Okay, sometimes women say, maybe if I just didn't drink as much. But if you don't drink as much, well, now your body might get dehydrated, and we know dehydrated muscles, well, they might not work as well, you know. So we need to keep you really well hydrated so that your womb is working efficiently and effectively, and your body is working efficiently and effectively on this very important day. So the admission procedure, so coming into hospital. A couple of things just to note. I suppose car parking would be one of them. So our hospital car park, so you're more than welcome to park here Monday to Friday, anytime from 5 p.m. to about 11 p.m. And at the weekend, anytime at the weekend from, you know, maybe 6:30, 7 a.m. right up until 11 p.m. And the way the car park works is you just drive up past the main reception, you'll see the barriers on the right hand side, they will lift and allow you to drive in, find a space, you won't be given a parking ticket or anything like that, and just to get back out of the car park, you just drive back up to the red barrier, and you're either going to use your card to tap yourself out, and it will take €6 from your account, or you'll have €6 in coins, and you can use that to open up the barrier. If you're coming into us Monday to Friday working hours, okay, so any time outside of the times I described for our car park, we'd recommend the Parnell Street car park. So it's just opposite Penny's there on Parnell Street, and you can park in there anytime. It's 24-hour, and they have a deal with us where if you bring your car parking ticket to our security team, they will stamp and sign that for you, and they will honour the rate of €6.50 for the duration of your car being in that car park. So do you know, especially for something like coming in labour, you could be here for quite a while, so it's a nice safe spot just to leave your car for the day. Once you're parked safely, you're going to come to the reception area. So when you get to the main reception area, just let them know. So up to the white desk with the glass screen, and just introduce yourself. Let them know that, for example, I'm Susan Hogan, and this is my date of birth, and I'm here because I'm in established labour. So be quite clear about what you're communicating across, and that just means that nothing will be lost in translation. They'll ask you to take a seat, and they'll let the emergency room know that you're here in labour, and we'll call you in as soon as possible. When you pop into the emergency room, you're going to meet a midwife, and the midwife is going to introduce herself, and she's going to ask you a couple of questions just about what's been going on so far. So, you know, have your waters broken? If they have, we'll ask you about the coat acronym that we would have mentioned in video 1. They'll ask you if you had a show, your contractions, when did they start, how long are they lasting, how often are they coming? So this just gives us the bigger picture as to everything else that's going on. Are you feeling baby moving around? Then we just need to, I suppose, perform a physical check. So we'll check your vital signs, your blood pressure, your pulse, your respiration rate, and your temperature. And if you needed to go to the bathroom, we might ask you for a urine sample as well, that we're just going to check to make sure that you're not dehydrated. Then we need to check over baby. So we usually ask you to lie up on a bed in the emergency room, where the midwife will just have a feel of your tummy. So we want to see, you know, where is baby's bum? Where is baby's back? Where is baby's head? So this lets us know which way he's facing. Now we've felt where his head is, we want to feel, well, how much of his head has entered the pelvis? So again, this just gives us a little indicator as to how things are moving along. We'd like to monitor baby's heart rate as well. So we'll monitor baby's heart rate continuously for about 20 minutes using a machine called a CTG machine. So that's where a little probe is popped here on your abdomen to monitor your contractions, and another one on your lower abdomen to monitor baby's heart rate. And they're just held on with stretchy belts. So once we've monitored baby's heart rate, now we need to assess the neck of the womb. So we'll examine the neck of the womb, we'll let you know exactly what we're finding. If the neck of the womb is thin and soft and 3 centimetres dilated or more, that's when you're going to be admitted to the delivery suite. If the neck of the womb is still a little bit thick, so hasn't fully thinned out, or not yet 3 centimetres, that's when we would be giving you the option to go back home again, or possibly to our early labouring department. On the early labouring department, as I described earlier, what we try to create is like a home away from home. So unfortunately we don't have control over, I suppose, the traffic in the room, but if you would like to go moving, if you would like to have a bath, you know, all those things, keep doing what you would have been doing at home. If you're admitted to the delivery suite, just to explain the system and the monitoring that happens up there. So you'll have one-to-one midwife care. So you'll have a midwife looking after you, and you'll be in a single room. So you won't be sharing your room with anybody, and you'll more than likely have a student midwife working with the midwife that's looking after you. That room that you're admitted to, that's where you're going to be for the day. So you'll be there all through your labour. It's the room you're going to give birth in, and it's also the room where you're going to do your skin to skin and chill out and feed your baby afterwards. while you're in established labour, okay, so guidelines for monitoring babies in established labour are a little bit different to monitoring babies in early labour, okay? So in established labour, we like to listen into baby's heart rate every 15 minutes for 1 minute. We like to check your vital signs every hour. We like to check your urine for dehydration every hour, and we like to assess the neck of the womb every 2 hours, okay? So if it's okay with you, ideally we'd love to get those checks done, and we'll happily work around you. You know, so if you're in the bath, that's no problem. We can pop in every 15 minutes and listen to baby's heart rate while you're in the bath. If you're walking, I might say to you, okay, sure, pop back to me at like 1:15, 1:45, and on the hour. So we'll make a little plan, so whereby, you know, you're in control and you're having the day in which you had expected, but we're also getting our monitoring done and we're making sure that your baby is okay. You might have heard of continuous monitoring before, and I think it's important just to touch on that slightly as well. So intermittent monitoring, the monitoring every 50 minutes, that would be standard, okay? However, if we have one of the following 5 situations happening, this would warrant a changeover to continuous monitoring, okay? So example number 1 would be if there was meconium in the water. Example number 2 would be if you were on an oxytocin drip. Example number 3 would be if you had an epidural. Number 4 would be a premature baby. And number 5 would be a baby showing signs of fetal distress. So if any of those 5 things are happening, that would be when we would be changing from intermittent monitoring to continuous fetal heart rate monitoring until baby's born. Positions for labour. Okay, so physio are going to talk more about positions for labour and birth in class 5, but I think it is important when we're talking about labour just to have an understanding of the basics. So the basics being keep upright, knees open, and keep moving. Okay, so why are those things important? Well, if we're standing, what force do we have working with us? We've got gravity, okay? So gravitational pull will help move baby down if we're standing. Knees open, so why is that important? Well, if your knees are wider than your hips, okay, whether you're kneeling, squatting, standing, your pelvic outlet, so this part here that your baby needs to fit through, this actually expands, and it can expand to approximately an extra 25%. So you're giving your baby probably a little bit more than a quarter of extra room to move here. So again, it's a bit of a no-brainer. You'll find in established labour, like your body is doing these things. It would be very unusual to see a woman in established labour like sitting like this or like this. But in the early stages, I kind of think be mindful of it. You know, so of course in established labour, you're achieving all of this. But in the early stages, why not consciously find yourself or put yourself into positions where your knees are wider than your pelvis? Because this is just going to give baby much more room when he's making his way down into the pelvis and things are just kind of getting started. There is a poster like this in every delivery suite room. Okay, so when you're on delivery suite, just glance up at the poster. It might just inspire you or reassure you that you're on the right track in terms of baby's position. Thanks a million.